Good morning. My name is Kimberly Guy. I'm the president of St. Joseph's Children's Hospital and St. Joseph's Women's Hospital. And on behalf of the Baycare Health System, it is my privilege to welcome you here today. We are so pleased to host this press conference because it underscores our commitment to the community and getting our members enrolled in the marketplace. As the largest not-for-profit health system in this region, our mission is to provide care to the community irrespective of the ability to pay. We have been partners with University of South Florida and other communities in the first year of this initiative as the health system partner, and we are so excited to begin our second year. Together we can continue to bring quality, affordable care to the citizens of our region. I'd like to acknowledge and thank a few of our guests today. Mayor Buckhorn, we would deeply appreciate your local leadership and support for the marketplace. Congresswoman Cathy Castor, who is our Chief Healthcare Advocate in Congress. We thank you for being our champion as we work together to cover the Bay. Now I'd like to turn this over to Melanie Hall, who is from the Family Healthcare Foundation. Melanie, as well as the team and the University of South Florida, have been critical to our involvement and participation, and we certainly could not do this without her leadership. Thank you.
Good morning, everyone, and thank you, Kimberly. As Kimberly said, my name is Melanie Hall. I'm the Executive Director of the Family Healthcare Foundation, which is the lead organization for the effort that is through the University of South Florida. Our principal investigator, Jody Ray, is here with us today from USF, and we're happy to have her and her support as usual. We have been really fortunate to have tremendous partners in the community. Certainly we want to recognize Baycare Health System. They've been phenomenal as a partner this year and has allowed navigators to rotate through every one of their hospitals in the healthcare system, making these services widely available. We're really fortunate also to have several other very important community-based partners. For example, Healthy Start of Hillsborough County, Reach Up Incorporated, the Hispanic Services Council, United Way Suncoast, and Healthy Start Pinellas. So as you can see, we have great partnerships at work, really to making sure these services are widely available through our county. I'd also like to, before we start talking a little bit about how excited we are for year two, want to take a brief moment to reflect back on the very historic first year of open enrollment. One of the things that I think is fairly amazing is that in the first year alone, the national uninsured rate dropped by 26%, which I think is well beyond what anyone expected. 7 million of those are covered through the health insurance marketplace. And 1 million of those 7 million, almost 1 million, just short of 1 million, are actually covered here in the state of Florida. And so I think it's beyond denial at this point that the health insurance marketplace was quite a success in our state. And we are very proud and very happy to have been a part of that. One of the other things that I think is important to note about what happened here in Florida is that 9 out of 10 of the consumers that were enrolled in the health insurance marketplace received financial assistance. One of the #1 reasons that consumers that didn't sign up last year noted for not applying is they said they didn't believe that they could afford insurance. So we have a really important message to be able to reach out to our neighbors, our friends, our church and synagogue members, and be able to explain to them that there is financial help available, and that by going through the process, seeing what is available to them, and enrolling in healthcare coverage that is now considered very affordable, and we're going to talk about some of those examples a little bit later. One of the things that we have seen is that it really does offer a great deal of peace of mind to those families who, before that, were one broken bone or one unexpected illness away from medical bankruptcy, which happened far too frequently before this law was passed. So as we move forward into year two, it does make sense to take a step back and reflect on the successes of year one. Going into year two, we have 2 immediate goals. The first is to be able to reach out to folks that didn't enroll last year for whatever reason to make sure that they understand what their opportunities are and where they can find one-on-one, face-to-face assistance that can help them through the process. If it was overwhelming for them, we want to make sure that they understand that we're here to help guide them through that process. It's also important that we reach out to those that were enrolled last year and explain to them that there is actually a fairly easy way to get re-enrolled this year. The re-enrollment process is going to be an automatic re-enrollment process for those folks that are happy with their plans, that will just continue to pay their premiums and want to move forward with the coverage that they have. However, we're really encouraging everyone to go back into their account to make sure that they've updated their information, to look at new plans that are available that might actually better meet their family's needs, and make sure that they have the best coverage that fits their budget and fits their family's health needs going into the second year. So finally, I just think it's incredibly appropriate that we're holding this particular press conference here at St. Joseph's Women's Hospital, because women played a significant role last year in open enrollment. One of the things that I think often gets overlooked in this law is that it is no longer possible for anyone to charge a woman a higher premium based solely on the fact that she's a woman. The other thing that is important is that folks in general now have access to very important screenings and the ability to have that preventive care, which we all know is important to stay healthy. And I think a great example of that is a woman that I assisted last year who came in and she was in her mid-50s and she had 2 daughters in their mid and early 20s. And we went through the application process and she wanted to pay something. She said, you know, I'm self-employed, I certainly want to pay for insurance, but there's no way I can pay the amounts that I have been quoted through the private insurance market. So we went through the process and she was able to find a plan that fit the needs for her and her 2 daughters for $128 a month. And she was thrilled. It was something she could afford, and she was very happy to have that peace of mind that coverage brings. However, when I went on to explain the preventive services that would be available to her, she broke down in tears. She said, I'm 55 years old. I've never had a mammogram. I've never had a colonoscopy, and my mother died of colon cancer. I know that I need to have a colonoscopy. My daughters haven't seen a physician in 10 years. And in tears, she was just saying to me, you have no idea what this means. This was not the exception to the rule. This was a recurring event for us on an almost daily basis. The relief that we experienced with our consumers was palpable at times. And so we are going into year 2 energized, excited about being able to reach even more people, and thankful for the opportunity. So we've had some great, great partners in this process. And the first speaker that I want to introduce, I want to talk a little bit about my favorite statistic from last open enrollment, and I think it's a nice segue into introducing our speaker. And that is, last year at the end of open enrollment, Enroll America did a national survey asking people why they did or didn't enroll. And for the group that was under 29, the number one reason that they cited for enrolling was my mom, which I thought was pretty telling in a lot of ways. And so our next speaker is a mom herself, but her particular influence and efforts have extended so far beyond her family or our region, our city, or even our state. She's had, in her role on the Energy and Commerce Committee, a tremendous impact in terms of helping to craft this law, in terms of helping to support it and help people understand it. And we have been so honored that she has stood shoulder to shoulder with us through this whole process. So if I would like to have you join me in welcoming U.S. Congresswoman Cathy Castor.
Well, thank you, Melanie. That was very generous. And good morning, everyone. And a special thanks to the entire Bay Care family, especially here at St. Joseph's Women's Hospital. My earliest memory as a toddler was crashing. We lived in an apartment down the road in West Tampa, crashing my tricycle into a concrete staircase and having to come to St. Joseph's Hospital, and some kind of, I still have a little scar here on my pinky where I had to stick my hand
into some hot water, but they see it sealed up nicely. But Baycare, St. Joseph's in particular, has been taking care of families for generations in our community. And even on the elevator ride up, a lot of us were comparing, and just about everyone's child was born here, including my two daughters. So you all have quite a history of taking care of our families, and now it extends to making sure, Kimberly, that we ensure that all of our families, all of our neighbors, get the care they need. Thank you for your efforts last year. It's remarkable that Florida was the leading state in the entire country in signing up our neighbors for affordable health insurance. And a lot of the credit goes to the University of South Florida and Jody Ray and your team, along with Melanie Hall, our community health centers, Mayor Buckhorn and what he did by opening up all the rec centers in Tampa. We were proactive, and we knew that it was not appropriate to continue to say to families across this state and the community in this country that just because you had a cancer diagnosis, diabetes in the family, some pre-existing condition, that you should be barred from health insurance. And that's been a revolutionary change to benefit families all across America. Now I have, in addition to Melanie's statistics, I have a few from last year, and I'm going to read these as a challenge to everyone. Remember, the University of South Florida, the College of Public Health, and all of our partners here, we won the largest Navigator grant. Those are the folks that are going to hit the ground running. I understand a lot of the appointments are already filling up. They're going to help our neighbors sign up. We are fortunate in this area to have a very competitive marketplace. We're going to unleash the consumer power. Americans love to shop. We love to shop in this community. But sometimes when it comes to health insurance, it takes a little extra time to sort through all of the options. What's right for you and your family? But a lot figured it out last year with the help of our assisters and our navigators. In the Tampa Bay area, the number of individuals who purchased new insurance through the new healthcare marketplace, about 230,000. Most of those, as Melanie mentioned, was with a tax credit. Some of these are very affordable when you add on the tax credits. And the robust insurance policies that you receive are nothing like the paper-thin policies of the past. In the Tampa Bay area, about 50,000 young people were able to stay on to their family's insurance. About 1.7 million individuals with health insurance already now have those more robust policies. Remember, this isn't just for the uninsured. This has been fundamental for families with insurance. Your policy is better now. It means more. Just like Melanie said, women can't be discriminated against. Many have gone to the drugstore for their contraceptives and gotten a little bill. It says 0 on it. I don't think they even understand that's tied to the ACA and a lot of the reforms. Add on then the improvements to Medicare. In the Tampa Bay area, the number of seniors who receive Medicare Part D prescription drug discounts due to the Affordable Care Act, over 330,000, worth over $100 million back into the pockets of our older neighbors, our parents and grandparents. And then add on the other important reform for those with insurance, that the insurance companies can't charge you too much. They cannot take all of their profits and put it towards salaries and advertising, those kind of things. They've got to actually put it towards health services, doctors and nurses and hospitals, those taking care of us. And in the Tampa Bay area, families received over $58 million back due to rebates. Some of those checks came in the mail, some came to the employers. Many, again, don't realize this is tied to a lot of the reforms due to the Affordable Care Act. But $58 million back into the pockets of our families, you bet we can put that to good use. So remember, if you have insurance already, it's better. And if you have insurance, you want your neighbors to have insurance because you don't want them to be a burden on your health insurance policy. They show up at the ER. That cost is passed along to you. So we're gonna hit it out of the park this year, and that's largely due to all of you and the team in this room. Melanie, you have been a stalwart, signing up children all across the state for children's health insurance, and now this has been a revolutionary step of progress for those families, because now the entire family can be covered. Kimberly, thanks again, and everyone here at the Baycare family. Thanks to our community health centers, all of the hospitals in the area that are engaged, Jody, Ray, and the USF College of Public Health team. Congratulations again on being recognized as the best in the country. Together, by February 15th, we're going to beat that number of 1 million enrolled in Florida and do even better and ensure that our families have the financial security they deserve. Thanks, everybody.
Thank you so much, Congresswoman. So if Congressman Castor has been standing on one side of us, the person who has most definitely been standing on the other side of us is the mayor of the city of Tampa, Bob Buckhorn. He has been visible, he's been vocal, he's been enthusiastic, he has opened the parks and rec centers. He also has reached out to faith leaders. He's reached out to the business community. He has been absolutely a supporter in so many ways that have really made a difference. And I go to national meetings, and there are other mayors of other cities that stand up and talk about what they've done for their city. And I have to tell you, I feel very smug when I'm sitting in my seat, because I'm able to say, well, we live in Tampa, and we actually have Mayor Buckhorn. And it really makes me proud to say that I think he's been the model of how a local elected official can have a huge influence and make a big difference in an effort of making a community healthier. So, Mayor Buckhorn.
You know, I have come full circle this week. On Monday, I had the opportunity to play golf with Sister Annie, who is a Franciscan who is part of the whole Allegheny system that used to own St. Joseph's many years ago. And I will tell you, playing golf with a sister, especially when you were raised by the nuns, basically rendered me mute the entire 18 holes. There was not a word that I could say that I didn't think about, like, uh-oh, I better not say that with the sister here. And as my 9-year-old will tell me, when I'm playing golf, she says, Daddy, when you play golf, you have anger management issues. So I was silent the whole time playing with Sister Annie. But Mel, thank you very much. And to the folks here at Baycare, thank you for being such amazing corporate supporters of this. You know, we recognize that, that there's a benefit to the bottom line, but that's not why you do it. You do it because you believe this is important, and you believe that if people have access to better health care and more health care, or any health care, that we are a better community as a result of it. So thank you for stepping out. You didn't have to, but you did, and we appreciate that. And to my partner in Washington, D.C., the dynamic duo, Cathy, Castor, who is a voice for reason in an unreasonable place, and a voice for good governance, and how the civil discourse should take place, not the way it does take place in Washington, D.C. And she has been a great champion for Tampa and the Tampa Bay area. She is my go-to person in Washington, and we've had a good 4 years together, and there's going to be a lot more coming, but I couldn't think of a better ally than Cathy Castor up in Washington, D.C. But most importantly to all of you, as many of you know, I kind of live in the healthcare space. I live on the front lines of women's healthcare. My wife is an OBGYN, not at this hospital, at another small institution down the road, who delivers thousands of voters. So I understand what it means for a woman to not have access to health care. I mean, she truly is on the front lines of the mammographies and the pap smears and giving kids who are coming into this world adequate health care, not just when they walk in the emergency room because they couldn't afford health care before, but when they had adequate prenatal care throughout that pregnancy. And to know that, and understand this, what we did here last year, what Melanie did, and what Jody did, and what all of us did last year did not go unnoticed. I was in the White House when President Obama specifically called out Tampa, Florida, for leading the way around the country in energizing local jurisdictions in terms of getting access for their folks to health care. This isn't a Democrat or Republican issue. I mean, the days of that fighting are over with. This is a basic, fundamental issue of fairness, of access to health care, of quality of life. It shouldn't matter if you're a Democrat or Republican. The time for that debate is long since over, although those who keep trying to re-engage that, it's over with. You're not going to tell 1 million Floridians that you're going to take away their health care. You're not going to tell 250,000 people that live in this community that they are not better off because they now have access to health care when they didn't have it before. When they would show up in the emergency room of St. Joe's, when they would show up at Tampa General Hospital, not having had any health care, what do you think the results are going to be? I mean, tell me what you think the results are going to be. Not good. And so for me, it's never been about the politics of this. As mayor, I generally don't engage in the partisan stuff. I don't like it. It's not productive. What I care about is that hundreds of thousands of people who I represent and who Cathy represents now have a shot at a better quality of life, and they are not a burden to the system. They are not costing everyone else to subsidize the fact that they had no health care, and that they are healthier and their kids are healthier, and as a result of that, this community is healthier. Now, this recession is winding down, but not everyone is feeling the benefits of it. I mean, there was a story in the paper today about how folks are struggling still to this day, how they're working 2 or 3 jobs. Think about the additional burden in that environment when they have to work 2 or 3 jobs to make ends meet. Think about the burden of them not having health care. And think about that parent that knows that his children or her children don't have health care, and that their only place of last resort is to walk into the emergency room with potentially a chronic disease or not having the ability to afford to prevent that disease from happening in the first place. This makes a difference in the lives of the people that all of us are committed to serve. As mayors, as healthcare providers, that's what you do. You do this because you believe in something bigger than just yourself. This healthcare system obviously is in need of reform. But the basic fundamental premise that people are entitled to decent health care benefits all of us. We got to go register another 1 million. We did more than any other state in the country. We should be proud of that. You all did it, but now we have to go do it again. And so let the partisan stuff be put to rest. Let's make it a fundamental fairness question. Let's make sure that people recognize that we're a better community and a better state when people are healthy. It makes economic sense. It affects the bottom line, but most importantly, it affects our quality of life and our neighbors' quality of life and our kids' quality of life. And as mayor, I can tell you in no uncertain terms the quality of life of this city. So let's go do it again. You ready? All right, let's go.
I love that a lot of my navigators were here to hear that speech. It's very, as I said, he's very energizing. Our next speaker, we're really happy to have with us today. This is a person who started with us from day one, has been incredibly engaged as a navigator. She is actually at St. Joseph's Hospital, hired through the Baycare system to serve the uninsured, not only within the hospital, but as Kimberly said, as an outreach within the community, and to make sure that the surrounding community knows that these services are available. Elsa Rodriguez has done a really lovely job in working very directly face-to-face with families, and we thought it would be really helpful to devote a few minutes for you to hear what it's like from the perspective of a navigator, to be able to explain to you a little bit about what open enrollment and this work has meant for her. And then when she's finished, we're going to actually introduce one of her consumers who offers a different perspective, but we'll be able to tell you a little bit about that one-on-one assistance and what that meant for her. So Elsa, thank you so much for joining us.
Thank you, Melanie. How do I follow that in my ear? I feel like I need my pom-poms up here after that. Well, thank you for the opportunity that you have given me to share some of my experiences as a healthcare navigator. I started my journey because personally, I know how important it is to have health insurance for myself and for my children. And I was super excited to play even a small part in what I know is a historic event in my lifetime. So thanks to the Affordable Care Act, things are changing for the better. Despite of early problems we had, like you've heard several times already, over 900 million people in Florida alone have health insurance because of this. They've signed up for this, they've got their health insurance. I got to see firsthand the impact that having health insurance had on individuals and their families. How surprised so many consumers were that the plans were actually affordable. How surprised that they were that they can actually go see a doctor, that they can go to get their preventative cares, their mammograms, their physicals. You know, they realize that this is not a luxury, this is a necessity. And understanding that, even though they've known that from before, now, because of the Affordable Care Act, it's actually, they're able to do that. Seeing someone crying in my office because of the first time, you know, they've come back and they've received their mammogram results and they were so scared because breast cancer, you know, does run in their family, and being so satisfied that it came back negative. And having someone crying in my office, that was amazing. It was absolutely gratifying to me. It made everything worthwhile. But you know, it didn't end there. It didn't just end in enrolling in a health plan. We continue to help our folks, our consumers, our community partners, going out into the community and helping them how to use it, helping them find PCPs, letting them know if they have any questions in regards to where do I get my medications, how do I get my medications, things like that. That's what we were here for. It's a free service that we were able to provide, and thank God that I was able to come to Baycare in this role, because I'm able to help someone go through this. There's no way I was going to be able to do that working behind a desk in my other lifetime. So it's amazing to me when I get feedback from my consumers like Madeline, who tell me that for the first time in many years they've been able to manage their care. I've had other consumers come in and tell me that they were never able to manage their diabetes or their cholesterol. But now, because of being able to go to see their doctor, they're now on a regimen. They're able to take care of themselves. They're able to take care of their families. They're able to go to work and take care of their families and not have to worry about going into debt, going into bankruptcy because of a bill that they had to incur due to going into the emergency room due to a crisis. So we all know someone who doesn't have health insurance. We all know someone that doesn't have health insurance, and we know why this is so vitally important to everyone. So that being said, and I'm sure you'll hear this more often, but the 2015 open enrollment period begins this Saturday, November 15th, and ends on February 15, 2015. So yes, we have a lot of work to be done. We did amazing last year, but there's a lot of work that we have to be done. So bottom line, guys, bottom line is our mission. We need to step it up. We need to go out there. We need to make sure that we are present in our communities. We need to let them know that this is something that they do have help, that they do have someone that they can go to. And you know, our families and our communities depend on us. So let's keep it going. Thank you, guys.
I think Elsa is a great example of the excellent team that we have of 15 navigators here within our particular project, several of which are here today, and they worked so hard last year, and I couldn't be more proud of the team that we work with. So thank you to each and every one of them. Last but certainly not least, there are folks that tell us all the time what having coverage means to them. Being able to convince someone to come up and tell a group of reporters is a little more challenging. And so we are always very excited when we have a consumer that will agree to do this. It's a little overwhelming, but at the same time, it is oh so important for you to hear, not from us, but from the actual consumer, of how this has benefited them, what their experience was like, and what their plans are for year 2, because I know that that's something that many people are interested in. So we're really fortunate to have with us today Madeline DeBose-Rock. And Madeline is going to come up and tell you a little bit about her experience. But just as a little bit of background, Madeline did try to navigate the system herself and enrolled, but realized that she was in a plan that didn't cover her specific needs. And so she was really fortunate that she got to Elsa's desk, and Elsa was able to sit down and go through with her. And it was still during the open enrollment time where she could reconsider her choice and look for a choice that may suit her needs a little bit better. So that I am going to just tee that off to Madeline, who's going to explain to you about her experience and what the affordability piece has meant for her. And then I will wrap up a little bit with some last-minute details of what our plans are for the coming year. So Madeline, thank you so much for coming today.
Thank you to everybody, and thank you to Elsa. So I hope I can make through this without tears, but I was grateful that my past work experience actually led me to Baycare. For those of you that know me in the community, I actually had Baycare as a part of my client base at one point, and 3 of my 4 children were born here at Women's. So when I needed some assistance, I just assumed that I could find it here, and was very grateful that the person that was here to answer my questions was Elsa. So to give you a little bit more of an insight on that, to say I had a few questions is an understatement. Because I wanted to make sure that all of my needs were met. I wanted to make sure that everything was done within the deadline. And I wanted to make sure that whatever assistance I could get at this point in my life, having to restart my career, going from a significant salary to literally scratch. So it was really beneficial to me to find out that I could qualify for less than $2 a month and get health coverage, that I could have all of the benefits available to me that are included with the plans, that I could know that if I ever injured myself again, I could go to the hospital in my plan and know which hospital it was, and go to doctors that I knew exactly which doctor I could be calling on. That the doctors that I did select are more than gracious for the clientele that they have now. I know some doctors were a little bit overwhelmed with the volume, to say it mildly, but the doctors that I selected were gracious and very comforting to all of us that were coming into their office in mass numbers or increased numbers, whichever way you want to look at it. So in order to have the coverage I have, in order to be able to utilize it when I need it, in order to know everything about it in detail, I was able to get that level of information from Elsa. I know that Baycare is an excellent system. I'm not knocking the other systems that's here in Tampa, but my experience with them has been just to the top ever since we moved here, and that was more years than I care to mention. But I'll just say over 30 years ago I've been here, because my youngest is now 30. I can give her age. But I do want to thank Elsa and her team, everybody that is a part of it, for everything they've done for me and my family. And I do say thank you.
Thank you, Madeline. You did a great job. So before we wrap up today, I just wanted to throw out a couple more dates. Vanessa did a great job of doing a nice plug for the opening of open enrollment, which is this Saturday, November 15th. There are a few events happening next week, some enrollment events that would be very helpful. There's a list of enrollment events by county in each of your press packets. But a few to be aware of, because they're coming up quickly, is a mass enrollment event on the USF campus, and there's a number there to call. And several of our navigators will be there, along with the USF navigators, and there will be plenty of assistance available for folks on Monday the 17th from 9 to 3. Also, there is an event at Polk State College on the 19th from 4 to 8 for residents in Polk County. And then we're doing our first large-scale event at Hillsborough Community College, the Dale Mabry campus, next Saturday, also from 9 to 3. Hillsborough Community College has been a tremendous partner, stepping up and allowing us to do enrollment events on every one of their campuses this coming open enrollment session. So we're very pleased that we're going to be geographically dispersed, and there's large enrollment events, as well as those one-on-one appointments that are available by calling our project line, which is 813-995-1066. So thank you for your interest today. There are several of us that are available for questions afterwards if you'd like to ask some more specific questions. And we appreciate you helping us spread the word that the opportunities are available, financial assistance is likely, and coverage offers peace of mind for all of our Floridians. So thank you again for joining us, and thank you so much to our speakers who help us spread that word every day. Thank you.